Adrenergic agonists, also known as sympathomimetics because they mimic the sympathetic nervous system. We have 5 different adrenergic receptors, subtypes. They all work through the G protein signaling method. And the first subtype here is alpha 1. It's a GQ protein. So whenever phenylephrine, which is selective to alpha 1 receptors, binds to it, it's going to increase the amount of calcium in the smooth muscle cell and cause constriction of the smooth muscle of our blood vessels. This is going to increase the peripheral vascular resistance and increase our blood pressure. It's also going to decrease the amount of leakage into the nasal mucosa, so you can use it as decongestant. Also, epistaxis, where you have a nosebleed, you can clamp down on those blood vessels and it's going to prevent the nosebleed. I had one before. I used Afrin. It probably has either a phenylephrine or pseudoephedrine in it. Both of them work on the alpha 1 receptors, and it just magically disappeared. Alpha 2 receptor, clonidine, binds to this subtype, and this is one that's G inhibitory, so it's actually going to dampen the sympathetic nervous system. So this will be one that you can decrease blood pressure with and also calm a person down if they have ADHD. And then beta 1 subtypes, these are found on the heart. So they're found on the nodal cells, like the AV node, that determine your heart rate. And they're also found on the cardiac muscle itself to determine contractility of the heart. So if you take a drug like dobutamine, maybe for acute heart failure or cardiogenic shock, you want to get the heart pumping and working so you can get perfusion to your brain and your heart and other vital organs, then you can stimulate that beta 1 receptor and have an inotropic effect on the contractility and a chronotropic effect on the increasing the heart rate. Beta 2 subtypes, we find these in the smooth muscle of the bronchi in our airways. And if we need to increase our airways, we can take albuterol, which is a beta 2 agonist. It gets in there fast, opens up the airways if you're having an asthma attack or if you're having a hard time with COPD, chronic obstructive pulmonary disease, and need to open those airways up quick. It's short acting, but it also gets in there really quick and gives you immediate relief. Beta 3 subtype, we find these on the detrusor muscle, which is the smooth muscle of the bladder. When Mirabegron goes and stimulates this beta 3 receptor, it's going to cause relaxation of the detrusor muscle, and that's going to put less stress on the urgency to urinate. So if someone has a overactive bladder or frequency problems, then you can relax everything, that urination pressure, by decreasing the smooth muscle of the detrusor. And that's what Mirabegron does. And then these are all selective, so these all kind of target one specific subtype. They may have a little carryover to other ones, but they're really good at selecting specific subtypes for specific symptoms. But then if you take just something general like epinephrine or dopamine, they will stimulate at low dosages the beta receptors, but at higher dosages they'll get into the alpha receptors too. So if you're having anaphylactic shock, your blood pressure has plummeted, you have histamine opening up little arterioles all over your body. So you have this mass effect of just vasodilation, and so you have severe hypotension. You need something fast to get perfusion to your brain and to your heart and other vital organs. So epinephrine, it's going to get that inotropic and chronotropic effect on the heart, get it pumping harder. It's going to open up your airways because with anaphylactic shock, it's harder to breathe. It's going to have those beta 2 effect. It's also going to, at higher dosages like an EpiPen, it's going to increase alpha 1 activity. It's going to clamp down the blood vessels that have been dilated and get that peripheral vascular resistance back and get that blood pressure restored. So that's just kind of a general overview. There's many more drugs, but that's just one common drug for each subtype. And I hope that helped you, and I'll see you in the next video.